All right, let's spend a minute or two thinking about how a very specific infection, septicemia, often leads to death. So, septicemia is any microbial growth in the blood. Most cases of septicemia are bacterial. I think like 10% end up being fungus. And they're often introduced parenterally, meaning that an IV injection introduces the bacteria into the bloodstream. So this is extraordinarily common in like IV drug users who share needles, can often lead to this kind of infection. The worst bacterial infections in any other part of the body can spread to the blood and eventually lead to septicemia as well. So it's not just parenteral, but that's a particularly common way people become infected. So after a person is exposed to bacteria, it gains access to their bloodstream and starts growing. We have septicemia, microbial growth in the blood, and we will see like some initial prodromal signs and symptoms. So we'll see some pretty non-specific stuff like fever and chills and perhaps some GI symptoms. At this point, we might not have any warning bells going off. However, if we are monitoring a patient or a patient comes into the doctor a little bit later, we might see a more specific sign. And that is, as the infection progresses, it leads to something called respiratory alkalosis. So first, the patient's breathing rate is elevated. This is because of some inflammation in the lungs, and it triggers a faster respiratory rate. But we start breathing more rapidly. This increases the amount of gas that we exchange in breathing. We're breathing faster than we need to. So that's going to put more oxygen into the blood and take more carbon dioxide out. And it's that carbon dioxide part that's important. So as the amount of carbon dioxide in the blood gets lower, that changes the chemistry of the blood. In liquid, carbon dioxide usually forms this chemical called carbonic acid. But if there's less carbon dioxide in the blood, well, now there's less carbonic acid. So less acid means the blood will be less acidic, which is more alkaline or basic. So respiratory alkalosis is just this breathing, respiratory action, leads to the blood becoming more alkaline. And this begins to be pretty dangerous. But that's not typically what causes a septic patient to die. The most risky part of this infection is that these bacteria that are infecting our blood often release endotoxin. That endotoxin stimulates inflammation throughout the entire circulatory system. And as we know, inflammation has a very systematic set of steps that happen, right? So when we have inflammation, we know that we get increased vascular dilation. We get vasodilation. So usually this would happen in one spot where we got some inflammation. Like if I cut my finger, the increased we'd get this vascular dilation just in my finger. But when the bacteria are growing throughout my entire circulatory system, we stimulate vasodilation everywhere in the circulatory system. So every sort of pipe in the circulatory system becomes bigger. This means that the amount of blood filling the system isn't enough. The blood pressure goes down because of that. In addition, we know that inflammation triggers vascular permeability, right? This is so that the white blood cells can get into tissues and try to kill any infections that we're having. But again, in this case, where the bacteria is growing in the blood and it's triggering inflammation everywhere, we're going to get that increased vascular permeability everywhere. That means that fluid is going to start leaking out of my blood everywhere. And this leads to a rapid decrease in the amount of blood that's in my circulatory system. So first I made the circulatory system larger by doing the vasodilation. And then I further decreased the amount of liquid in my circulatory system by making all of my blood vessels leaky and a bunch of liquid leaked out. And this leads to a drastic decrease in blood pressure. This is often referred to as like endotoxic shock or toxic shock syndrome. And it's this rapid decrease, this rapid catastrophic decrease in blood pressure, which often kills people. So septicemia is a big deal, right? Again, we could avoid risk by avoiding IV drugs, and seeking out treatment for bacterial infections before they progress and gain access to our circulatory system. And then the next important thing is that these symptoms progress really rapidly. So when we see a person with septicemia, it's really important to treat them aggressively. And we want to start antibiotic treatment as soon as possible. And then we want to adapt that antibiotic treatment to make it more specific as we sort of gain ground on this infection. But we should never wait to treat a septic patient, because the death can happen far too quickly. If we wait to decide what drug to give them, we might just wait too long. So anyway, that's septicemia. As always, let me know if you have any questions.